Why does healthcare cost so much in the United States? A simple hospital visit can cost thousands of dollars. The same treatment often costs far less in other wealthy countries. Yet the United States spends more on healthcare than any country in the world. For many families, medical bills are a constant source of stress. And even with all that spending, Americans often live shorter lives than people in other developed nations. So what is actually driving these costs? To understand it, we need to look at how the healthcare system is built. In many countries, healthcare works through one clear system. Prices are negotiated centrally. Payments are simpler. And hospitals usually follow the same rules. But in the United States, healthcare is highly fragmented. There are thousands of insurance plans, different hospitals, different drug companies, different payment systems. Each part operates on its own incentives, and together, they push costs higher. In this video, we will look at 6 forces that make healthcare in America so expensive. Administrative complexity, high medical prices, drug pricing power, pharmaceutical middlemen, hospital consolidation, and the way doctors are paid. Healthcare costs are not driven by a single problem. They come from many small forces working at the same time. Each one adds cost, and together they create one of the most expensive healthcare systems in the world. The American healthcare system is extremely complex. Doctors and hospitals deal with thousands of different insurance plans. Each plan has its own rules, its own billing forms, and its own approval process. So hospitals hire large administrative teams just to handle paperwork and insurance disputes. In some cases, there are nearly as many administrative workers as medical staff. All of that overhead costs money, and those costs are eventually passed on to patients. Many people assume Americans simply use more healthcare. But the data shows something different. Americans actually visit doctors less often than people in many other countries. The difference is the price of each service. A routine procedure in the United States can cost 2 or 3 times more than the same procedure elsewhere. Doctor salaries are also higher. Specialists in the United States often earn far more than doctors in other wealthy countries. So every appointment, test, or surgery carries a higher price. Prescription drugs are another major driver of costs. Americans often pay much more for the same medicines sold in other countries. One reason is pricing power. Many governments negotiate drug prices directly. But in the United States, prices are often set by the market. Drug companies can also extend their control over a medication through patents. Small changes to a drug can sometimes extend exclusive rights for years. That delays cheaper generic versions and keeps prices high. There are also companies that sit between drug makers and insurers. These companies are called pharmacy benefit managers. They negotiate which drugs are covered by insurance plans. But their compensation is often linked to a drug's list price. So higher list prices can sometimes benefit the middlemen involved. Because these negotiations are not transparent, it can be difficult for patients to see where the money goes. And each layer adds another cost to the system. Over time, many hospitals have merged into large health systems. Independent hospitals and clinics have been bought by bigger networks. In many cities, only a few hospital systems remain. When competition disappears, prices often rise. Large hospital networks gain stronger bargaining power with insurance companies. and those higher prices are eventually reflected in insurance premiums. Finally, the payment structure itself plays a role. For many years, the United States system has used a fee-for-service model. Doctors and hospitals are paid for each service they provide. Every test, every scan, every procedure, each one generates a separate payment. This creates an incentive for more activity, not necessarily better outcomes. More tests, more procedures, more billing, and more total spending. When you put these forces together, the pattern becomes clear. Administrative complexity, high prices, powerful drug markets, and payment incentives all push costs upward. And because the system is fragmented, no single part controls the overall price. So the costs continue to rise across the entire system. Understanding healthcare costs requires looking beyond the doctor's visit itself. Behind every medical bill is a network of insurers, hospitals, drug companies, and payment rules. Each part plays a role, and together, they shape one of the most expensive healthcare systems in the world. This is Simple Explain, complex ideas simply explained.